talking about sleep apnea, which is a very popular topic. Tell me about sleep apnea, or specifically obstructive sleep apnea, or OSA.
Boy, that is a mouthful. We will get into it. So we're not going to talk. We're not going to talk on a medical level. We're going to talk to the veterans in layman's terms, and we're going to get to the bottom of what exactly obstructive sleep apnea is.
So I snore. My wife told me I snore one time, and she said that I might have sleep apnea. Can you tell me about sleep apnea?
Sure. Let me talk to you about sleep apnea. I get these questions all the time from lots of people. This is a popular topic. People want to know about sleep apnea. It's a little confusing because it's called obstructive sleep apnea. Obstructive sleep apnea means that you have, through your nose and your mouth, you have this oropharynx that goes down there into your lungs. And in this pipe, where a windpipe is going on down, you get some kind of obstruction. Okay? It can be caused by a deviated septum, something going out of whack. It can be caused by enlarged turbinates, inside your nose. It can be caused by tonsils, enlarged tonsils, adenoids. It can be caused by just fat around your throat.
Muscle too, though.
Yeah,
right?
muscle too. It can be caused by lots of stuff. But something is basically obstructing this thing. And so in order for to get good air movement on in and out, it gets blocked. And that's why, when you block something, it makes a noise. And so that's why when you're snoring and it's basically getting stuck there. So that's obstructive sleep apnea in a nutshell. We're going to talk a little bit more about it. But then there's also something called central sleep apnea. Central sleep apnea is very, very different. It's the same thing. Apnea is when you have these events where you can't breathe. And so central apnea, which is not nearly as common as obstructive sleep apnea, this one is where your brain is just basically not telling your diaphragm to take a breath. And so it is a neurological problem. It is a disconnect between the brain and the diaphragm telling it to go. And I happened to be in a surgery just the other day, and it's fantastic. They implanted one of the first clips right there on the vagus nerve, so that when your brain is not sending the signal down and you have this apnea problem, it will actually fire a little electric shock, and it'll tell your body to start breathing again. So
that's cool.
So there's lots of cool stuff going on with sleep apnea. People would love to get rid of it because it is so stinking common out there. What exactly, though? What are you looking for as a doctor for sleep apnea? Somebody does come in. Seriously, they come in and tell you that my wife makes me sleep in another room because I snore so much. How do you diagnose sleep apnea?
So whenever a patient comes and sees me and they say that their spouse told them that they're snoring and they need to go be seen about it because they're going to leave them if they don't stop snoring. So I usually ask them questions, right? Because we have this questionnaire and scoring system called the Stop Bang questionnaire. And so we'll ask questions like, do you snore? Has your spouse been told you snore? Do you have episodes where you stop breathing? Do you have excessive daytime sleepiness? And from that, there's other questions that we'll ask to figure out how sleepy you are. And based on that score, we'll determine how likely you are to have sleep apnea or not, and do you need a sleep study? So someone comes in and sees you, and you determine that they are warranted to get a sleep study, so take it from there.
Okay. So one of the things I would do, which by the time you come into us and you talk to us about sleep apnea, you usually gotten a sleep study. We don't diagnose you. But when I would diagnose people, one of the things I would do is I would look inside their mouth. I would look and see there's a Mellon-Potty score where they try to see how much of your oropharynx in the back is blocked by your soft palate and then blocked by your tongue. So we kind of try to see how crowded your mouth is, to see how likely you are to have sleep apnea. One of the other things that we do is we look at an Epworth sleep exam, where we basically try to figure out how likely you are to fall asleep in certain situations throughout the day, like stopped at a traffic light. If you're talking to your wife, how likely are you to fall asleep in the middle of the conversation if it's interesting? How likely you are to fall asleep while you're watching TV and stuff like that. So we take that Stop Bang, we take the Epworth sleep exam, and then we take the physical exam, the Mellon-Potty exam. We put them all together and we try to figure out how likely is this person to have sleep apnea. And if we feel like it's something that's warranted, we send them for a sleep study. So the problem with the sleep study is sleep studies are not free; they're expensive. And so before we do it, there's a couple different little tests and little things that we can do inside the clinic just to see if we should spend the money to evaluate you. Because not everybody who snores has sleep apnea. a lot of people snore for a lot of different reasons, but it doesn't mean it's sleep apnea. So once they get to the point where the doctor has felt there's enough here, let's send them for a sleep study. They have two options for a sleep study. So they have an inpatient option, and then they have a take-home. The take-home, you do it at your own house and you get a good night's sleep and all that other stuff like that. That hasn't been so popular over the years, but with COVID, they've kind of started going that way. So now we see a lot more at-home sleep studies, and then also the inpatient one where you come on in there into the clinic and they make you sleep overnight. And so there's that. Now that we've got you diagnosed with sleep apnea, let's say that you get your sleep study and it says, yes, this person stopped breathing a couple times at night. They're either mild, moderate, or severe obstructive sleep apnea. Let's get them a CPAP. So what exactly is a CPAP machine, and how much fun is it to wear one of those things?
Well, I'm glad you asked, because some doctor that I know made me get a sleep study, and as a result, I wear a CPAP. It was him.
But that's because he's got such a muscular neck.
Sure, yeah. So a CPAP stands for continuous positive airway pressure. And essentially, as he said, obstructive sleep apnea is at some point in your airway, there's an obstruction, from your mouth to, all the way down to your throat. So it's continuous positive pressure to get through that obstruction, and you wear it ideally every time that you sleep and for the entire duration of sleeping. And there's, lots of times people will picture it as, the big, Darth Vader mask, but, it is 2022 now, and they have a big range of different types of CPAP masks, right? And so basically it's hooked up to a machine and it pushes pressure so that you can breathe and not snore while you sleep. Get a good rest, good night's sleep, and you wake up more refreshed. It decreases your risk of having other conditions that can actually be serious.
Yeah, of course. It can lead to a lot of different problems. That's why we treat it so serious. One of the things that I always find interesting is people will always come to me, through the VA system, and they'll say, hey, I've got sleep apnea. The first thing I look for is I look through the medical records and I try to find whether or not they've had a sleep study. The VA will send you for a sleep study. They won't send you for an endoscopy, they won't send you for a couple of things, but they will send you for a sleep study. And one of the reasons why they send you for that sleep study is because, like I said, not everybody who snores has it. And so when people, what we notice is people will say, I snore. People have noticed me stop breathing. I wake up coughing, choking for air, or I'm excessively tired during the day. If you don't get into that REM sleep, at night, you're going to be excessively tired during the day. So you can have all the symptoms of sleep apnea. If you don't have a sleep study, you're not connected for obstructive sleep apnea. Sometimes you'll go there and they'll say that, hey, this person is a heavy snorer, but it's not sleep apnea. And then at that point in time, our hands are kind of tied as medical examiners because you're not diagnosed with sleep apnea. There's nothing we can do about it. So that's what happens. But let's say that we do get it. One of the questions that I always ask, that's on the disability claim is, okay, you're diagnosed with sleep apnea. Do you wear your CPAP machine at night? And so that's one of the questions that they want to know. Did you get a CPAP? Because if the pulmonologist didn't think it was severe enough to give you a CPAP, then it's probably not that severe that you need to worry about it, because they love to give CPAP machines. The other thing is, are you taking any medication at night to help you sleep? A lot of people don't know it, but if you do take muscle relaxers, you do take Ambien, you take some of this other stuff, it will actually cause some more laxity in the back of your throat, and it'll cause you to actually exacerbate symptoms of sleep apnea. So it's important to know, are you on a medication to help you sleep, because that can be it. So what is sleep apnea not? When people come to me and say, I've got a problem sleeping, and I think it's sleep apnea, and I start asking them questions, and I find out this isn't really sleep apnea. This is insomnia, or this is nightmares. Not all sleep problems are sleep apnea. So what is sleep apnea not? What have you seen?
A litany of different things. Insomnia is kind of the most common thing, right? People say I cannot get to sleep. When I finally get to sleep, I kind of wake up right away, right? And that's usually not sleep apnea. You don't usually have trouble getting to sleep. It's not part of it. Restless leg syndrome or sleep movement disorders is very common, right? People will get to sleep just fine, but then they'll move around and they jerk around and they wake themselves up from that. Yeah. That's very common. Or other, REM sleep disorders are common. So that's why the sleep study is important, is because it might not have obstructive sleep apnea, but it can identify other causes of sleep. Obviously, sleep is incredibly important to be healthy and get a good night's rest.
Yeah, one of the cases that I saw that was really interesting was the guy had benign prostate BPH. And so the problem with that was he had to get up and go to the bathroom every hour. Well, how good a sleep are you going to get if you're getting up every hour to go to the bathroom? And so just because you're having a difficult time sleeping, that's not necessarily obstructive sleep apnea. So that's why we get the sleep study. That's why we do it. So we talked about how we diagnose it. We talked about how we treated it. Some of the claims that I like to see, with sleep apnea, if they've got it on active duty, if they've got some kind of deviated septum that's service connected, if they have chronic sinusitis that's service connected, they've got a problem with their sinus that will cause obstructive sleep apnea, enlarged tonsils. There's a couple of different things. Any kind of injury to traumatic injury to the face will cause it as well. But I did want to talk about one thing that gets claimed all the time, and the VA will not service connected for, and that is weight gain. So what can happen is people will have something like they might have PTSD, major depressive disorder, anxiety. They might have a lot of different things, and they're on medication, and the medication causes them to gain weight. And so I think we all know that a lot of the mental health medication will cause you to gain weight. And so when you try to walk the dog on what causes sleep apnea, and it's usually weight gain. We haven't talked about that yet, but we will in a second. It's usually weight gain. What will happen is somebody will say, I have this mental health problem that's legitimate. I take this medication, which is legitimate. I gain weight, which is legitimate, and I have sleep apnea. And so I think it should be service connected. One of the things that the VA doesn't necessarily like is not everybody who takes that medication does gain weight and cause sleep apnea. You are much more likely to gain a weight on those different medications. You're much more likely to gain weight if you have a back injury. You're much more likely to gain weight if you have a knee injury. And those might all be service connected, but just weight gain doesn't necessarily correlate to service connected. So a lot of the times what the VA will tell you is, I understand that you're gaining weight, and I understand that, but your injury does not prevent you from doing like Pilates or swimming or having a caloric restrictive diet and stuff like that. Not everybody who gets this is, and so every case is a little bit different. And so that is one of the things I've noticed with the VA is they do not like to give claims for weight gain. But one of the reasons why weight gain is so important is because that really is honestly the number one thing that we see. Anybody with a BMI over 25, which I weighed myself today, I'm sitting at 26, but sleep apnea is caused by weight gain. And as you get older too, the muscles and the laxity in the back of your throat, everything kind of just, it's just more prone to get sleep apnea. And if we test every veteran will probably most likely have sleep apnea as they get older, but it doesn't mean it's service connected. Right. So that's something to keep in mind on why a lot of the times some of these claims are denied. And it's because unless you have a specific case that causes you to gain weight, the VA does not accept that as a cause for sleep apnea. So that's sleep apnea. I mean, central sleep apnea is pretty, it isn't very common, and that's a little bit different. But obstructive sleep apnea is like 95% of what we see. And unfortunately, the cause 95% of the time too is weight gain. So. Yeah.
So it's important while you're on active duty and you think you might have sleep apnea or you snore, or your spouse tells you that you have episodes where you stop breathing, it is important to get a sleep study at that time if you can.
Yeah.
Or see your doctor and see if you warrant a sleep study.
Yeah. Yeah. And the VA will require a sleep study. You got to have a diagnosis to have it. And so, well, now we get to the point where I have my daughter here, Lily Weipert. She's going to come on up here and she's going to ask us a question, so we can get to know each other just a little bit better. Let's see, did I lock this thing? There you go. Okay, Lily.
Do you play sports in high school? If yes, what were they and did you enjoy it?
You take that one. Go ahead.
So I played basketball in high school. I played up until I was on JV and did not get picked up for varsity. So a short-lived career there. I was honestly not very good. I could say that now, looking back 20-something years. I was not very good at basketball. I enjoyed it. But I did run cross country and track. I ran cross country for 4 years, led it all 4 years, ran track for 4 years, and I did the pole vault, the 1 mile run, and the 2 mile run. And I was not very good at pole vault either, but it was a lot of fun.
Well, I played football, basketball, and rugby. Definitely rugby was my favorite because there was a lot less rules and you could hit people a lot more, and so I enjoyed doing that. And also it's big in Europe, and so I like to tell people I play rugby when I go to Europe. So.
Okay, so now we've talked a little bit about sleep apnea. That's by far one of the more common complaints that I see. I swear it seems like half the time it's about sleep apnea when I do these disability claims. So if you have any questions specifically, put them down there in the comments section. Email us. The email, thedisabilitydoctors@gmail.com. It's there. Go to our website, The Disability Doctors. Get on there and ask some questions. Look at some of our other videos. We have videos where we talk about lots of different claims. We talk about asthma, erectile dysfunction. We talk about migraines. We talk about GERD. Lots of different things on there. Just go on there, click on some of the videos. In order to make these videos, we need to get likes and we need to get people to subscribe so that we can make more of them and get them out to more people. So click the like and subscribe button. Leave some comments in the section below and come to our website.
Yeah.
So we're the Disability Doctors, and thanks for coming with us and talking about obstructive sleep apnea.
Thanks.